basically, what is your understanding of autism and why your approach is working?
No, the thing is, we were able to first tell that, okay, this is not everything is genetics, and there is something called environmental triggers, which is hastening the process of this particular issue of autism. And I basically started deep diving into something like biomedical intervention. And for me, it was like basically connecting the physiology and biochemistry. If you have any doctor can always understand what is biochemistry and and physiology, and we see there were a lot of threads not connected there properly. Means there was something called vitamin A assimilation was the issue, and the moment we started working out down that biochemical disorder, I can always tell you, you must be knowing about fats. It's a plenty. Everyone knows about fat now. In the fatty acids, there is a thing called linoleic acid. There is a thing called linoleic acid. Okay, there is a thing called from linoleic acid. The conversion happens to gamma linoleic acid. And this linoleic acid to gamma linoleic acid conversion is blocked in autism. You have something like vitamins you are aware of, something called folic acid. This is normally given in pregnancy to most of the people, and most of them people are folic acid is the issue. So all these children has got something called folinic acid. Is that there is a conversion from happens from folic acid to folinic acid, and that's blocked. Started working on something like MTHFR. Again, I'm deep diving. MTHFR is something like a methylation cycle. It's a kind of whole this one. Now we see most of the people who are sick have got the problem with that methylation cycle. And somewhere there is something called gene thrips, and there is a thing called glutathione. Glutathione is a good molecule. We now everyone knows that to you make yourself fair, you need to use that thing glutathione. But it is not just cosmetic purpose. The body makes its own glutathione, and so what is happening is that these kids are having a problems with this biochemical deficits. So if I'm able to correct that biochemical deficits. I'm able to correct something like the physiology part. Physiology is slightly difficult to understand, explain, but somewhere I can always tell you, you have got a something like a you have got a cell here. It's a rounded cell, and what happens is that all the nutrients, whatever we are giving, you are giving sodium, we are giving glucose, everything comes to this wall, and if this wall is not permeable, if it does, it this wall doesn't allow this nutrients to enter into the cell, things are bad. So this is what happens is most of the cases where we believe it's a mitochondrial disease. The mitochondria is one which is affected, and this is called mitochondrial cytopathy to be precise. And I try to work on that mitochondrial cytopathy precisely. And somewhere we use a lot of stuffs. We just don't depend only on some medications, trying to give some symptomatic cover, something like giving you all. See, what is happening is you are giving to decrease the hyperactivity. You are giving something like risperidone. How long you are going to give it? To decrease to keep a static the child, some autism kids, they start getting into something like fits also. How long you are going to give this fits medication? That approach is absolutely like not I can always tell you it's a reductionist approach, but we are not going to the base of the thing. So when we work on the basics, here there is a we call gut urine, this intestinal bacteria and all that as a second brain, and if we are able to manage that properly, put them on the physiology part as well as what I'm talking about, biochemical, this one. So this is the biomedical approach is very simple, and unfortunately, most of the pediatricians they are not aware about this. Most of the people are not aware. Just by giving these particular things, trying to avoid some dietary restrictions and all that, this makes a huge progression in the autism. And not just autism, we deal with something like ADHD, we deal with allergies, we deal with asthma. Just by diet as well as this particular stuff, what we are working on this biomedical approach, uh, get a big dividends.
How many years do you work with autism? What
More than 20 years. More than 20 years. I have been on
20
this
years?
one. I had gone up to all American Academy of Environmental Medicine, where we went up to a Autism Research Institute. I was brainstorming with somebody like Klingard, somebody like lot of people about what is the best what we can work it out. But I can say things have been quite. There was a big learning for me because from radiology, now I do almost all chronic diseases management by this approach. And for me, results are fabulous. The people who are having endless issues, they keep on doing stent, restent. Again, they have this fatty livers. People having this on like most of the people are having chronic degenerative diseases now. With this approach, I'm able to cater to them in a big way.
Mhm. What is included in your approach? What are you providing for children with autism?
Yeah, I worked with something like PK protocol, which is something called. It's a more of my this one. But again, there were some people in the other part of the world. They have started this. We call it as a detoxification. We work on this a big way. The first thing is to try to stabilize the membranes. The most of the people there is a problem with the blood-brain barrier where there's no proper inflow and outflow. So we try to fix that particular thing first, work on some things later, work with some things like hyperbaric oxygen. I do some simple detoxes also. Simple detox is something like taking out some lead, mercury. Um, it makes a big difference.
Tell me a few stories. For example, if child start to speak, if he never talk or something like that, or you start to
Yeah,
recognize
there is
mom.
that's
Just give
yeah
me a
that
few examples.
No, no, that's what I've been working on that because what happens is that we don't give that initial promise that your child starts speaking within this 21 days, but we have got some more than 70 to 80% very positive cases, and they are the thing is it was a surprise for them, for the parents. Okay. The child who has been not speaking for the last 3 4 years, he started making eye contact, started speaking monosyllables. That's also will be a great thing for the parent.
Mhm. What is included in your approach? What are you providing for children with autism?
Yeah, I worked with something like PK protocol, which is something called. It's a more of my this one. But again, there were some people in the other part of the world. They have started this. We call it as a detoxification. We work on this a big way. The first thing is to try to stabilize the membranes. The most of the people there is a problem with the blood-brain barrier where there's no proper inflow and outflow. So we try to fix that particular thing first, work on some things later, work with some things like hyperbaric oxygen. I do some simple detoxes also. Simple detox is something like taking out some lead, mercury. Um, it makes a big difference.
What are you doing? So, for example, the family, your child come to you.
Hmm.
How many hours they are busy in your clinic, and um, how many time it takes? For example, 10 days, 2 weeks. So if explain all these things.
Natalia, I think 10 days is too short period because we really don't, because this is just a kind of the first 1 week we try to stabilize the gut itself. Because it takes the moment we stabilize the gut, then we can always go to the next and start processing the others. So for me, at least I need at least 3 weeks time, 3 weeks, 21 days at least, so that I try to work it out. I use a lot of stuff. You must be aware of something like pulse electromagnetic field. You must be aware of something like laser, low intensity laser therapy. All those things I work it out. I try to improve the vagus, and once the vagus starts improving, things are better.
Mhm. So how many hours children get treatment per day?
It is usually something like 3 hours, to max 5 hours, because the children they try to acclimatize. We do some sessions which usually within 3 hours. What happened was we always used to see this as a developmental issue, and we used to think that just by doing some there is a behavioral therapy, something like speech therapy, something like sensory integration. These things are going to get better. Speech therapy. I can tell you it's not that easy. Only thing is you spend years in that, and the dividends what you get is not very good. This 21 days, what I'm telling is it has to be repeated also once you start on the this one. It's a quite a good thing. There are something like med maps people are doing now. Only thing is med maps as well as Dan is not done. Most of the functional medicine centers, most of the integrated medicine centers in US are doing this.
How often children need this treatment? One
See,
time per year or every
no,
five
no. I
years?
see. The thing is, I tell them if they are getting that 3 weeks, they are getting some head-on progress. I ask them to come after immediately after 3 to 6 months, and that's the way because we want to see development of the brain is this is the important part. You have got the golden period. If the child is less than 5, I make good progress. Above 5, it is a slow progress, but definitely we can change the kind of things because a lot of people come to us only in the late stage. So we always tell them, yes, you keep on doing this, and yeah, there are a good number of anecdotal cases as well as whatever we picked up here. Dan Rossignol has done a very good study on this. Dan is a good. There's a doctor called Dr. Anju Usman Singh. She's in Nepal Valley. We are all doing the same kind of work.
Mhm. But if this is metabolic problem, is it possible to fix forever or not?
Absolutely, yes. I stand by that because we are trying to work on this metabolic problem first, work on that issue, then trying to the root denominator. We are trying to fix that, and it's an easy thing. I should not. It's a time consuming thing. That's the thing. Parents are usually they are wreck. They keep on doing a lot of things. But I can always tell you the people who sustain for these 3 weeks, first 3 weeks, they get other patients for us.
Yes, sure. Which conditions do you treat? For example, some children they are not able to have eye contact. Some children very nervous and they are very noisy. Do you treat the children like this?
Most of the patients who come to us, they are into spectrum called autism spectrum disease, and it's a quite big. People do come with ADHD. People do come with learning disability. We had seen patients with cerebral palsy also. So we are trying to fix that biochemistry number one, and we are able to find out very good things. Even if something like a Down's case also, we have picked up one Down's case, Down syndrome, and we were able to solve the patient's GI tract. there was a big issue with this called Hirschsprung disease. There, my radiology effort counts. So this one, we were able to provide some good response with that child. You would like to see the clinic?
Yes, it's possible.
Yeah, yeah.
Please make us go.
I'll definitely take you to a tour. Uh,
Yeah.
One second. Yeah. This is my consultation room, and
Mhm.
this is from where we start here. This is the reception. This is what is we are situated in the first floor, and we have some kind of things. This is our stable reception room as such. She's one of our staff nurses here. But the patient is having a hyperbaric oxygen right now. These are the few things we try to work it out on. This is something I was telling you about that new things. What that is, what I use, and this is the my ultrasound Doppler room where I start looking at different things, and not just this one. I do something like dark field microscopy also, where I think it's very popular in Russia and all that. And I try to take a lot of info from that particular thing. These are our IV infusions. We try keep giving for a lot of people in the sense. A lot of chronic diseases. And with this is all our chambers. This is called hypothermias, sauna chambers. And yeah, it makes a big difference when the patient is having chronic ill. We use something like ozone therapies a lot. Ozone, you must be knowing about that because everything started from Germany and Russia. And this is our hyperbaric oxygen. This is yeah. This is our staff, Anis, and this patient is on hyperbaric oxygen, and this is what we try to promote for autism and all that. And apart from that, I do something like non-surgical uh, bypass, where we use something like because this is very getting very popular in US and all that, and where a person who is subjected for bypass surgery can always think about. No, this is our whole stretch actually. This is one of our extensions, and we are looking at all these things. What I was telling you about low intensity laser therapies, I was talking about something like millimeter therapies. We do some hyperbaric oxygen. We do this thing called PEMF in a big this way, and the same way we do this ECP. This is called external counter pulsation. This is much used in most of the cardiac cases, like anything. So this is all my clinic.